All this week, WNCT is hearing from the men and women fighting COVID-19 firsthand in our Hospital Heroes series. Today, we're in New Bern at CarolinaEast Medical Center. This hospital was one of the first in eastern North Carolina to start giving out the COVID vaccine. Today, 9 on your side's Madison Forsey went inside to talk to the doctors and nurses caring for the COVID patients. Madison, what did they tell you?
Well, that vaccine that you mentioned, that was a big boost for the people working inside of Carolina East. And they tell me with a year of ups and downs, the fight against COVID still isn't over.
The disease is still with us.
1 year later, and the one thing on the forefront of people's minds is still COVID.
Gene, I've never seen anything like it in my 40 years of experience.
Each time doctors and nurses enter a COVID patient's room, they suit up like it's day one.
I was pretty freaked out at first. You know, that first time going in a room with all the stuff on, you know, it's like you're an astronaut doing a spacewalk.
But a lot has changed.
I think our docs, since they've been treating it for longer, they know more of what works and what doesn't work. But it's still a very real threat.
They've seen patients young and old, healthy and sick, fight this virus.
The weird thing about COVID is you don't know which version you'll get.
While I was inside, all 3 hospital employees I talked to sprang into action after hearing this sound. That means code blue. One of their COVID patients was crashing.
In the ICU with the different diseases, things can change in an instant. I never make guarantees in the ICU, and specifically not with COVID patients.
But there is hope in the patients that go home and in the tiny vials of vaccine.
This is the risk of the vaccine. This is the risk of COVID-19. Nobody's dying from the vaccine. There are still thousands of people dying from COVID-19.
The doctors and nurses that I talked to today say that this isn't over yet, and people don't need to ditch the mask and social distancing quite yet, because those are our best defenses against the virus.
Some great insight, Madison. Thank you.